Having had 2 hip replacements, Anne often suffers from pain. After speaking to her nurse practitioner in Dunblane, she was referred directly to a physiotherapist rather than having to see a GP first.
And that was all done within 2 days, 3 days. Whereas if I had gone to a GP, I would have had to wait longer. But it's been much quicker. Everything's under one roof and it's been so quick.
So I'm going to have a look in this ear if that's okay.
Because Anne's GP is one of many practices across Scotland with in-house physios, mental health nurses and pharmacists, staff here say doctors' workload has been reduced, freeing up more time to focus on complex diagnoses.
But for some people, face-to-face is really, really important. And I think having people in a local setting within local communities, it means that we can actually do things quicker. We can actually do things to the right practitioner.
The Health Secretary says expanding GP services like this one are an integral part of our recovery from COVID, with £82 million being made available as part of a 4-year fund to improve patient services.
We're beginning to see improvements within the system, but it's going to take years for the NHS to fully recover. The physios I've spoken to today, the pharmacists I've spoken to today, they work as part of that team. And so yes, absolutely increasing that workforce is going to be a crucial part of our recovery in the future.
In and out.
And that workforce could come from here. These are first-year physiotherapy students at Queen Margaret University.
I'm really excited about it because I think that it helps us connect with the patients much quicker. It gives us an opportunity to treat them on a more person-centered case.
We're in a good-sized class here, but I know that it can be quite competitive, so the more positions that they are available for us, the much better it is for us.
It's great news if it increases access to physiotherapy, decreases physiotherapy waiting lists, and potentially decreases time that people will have spending on waiting lists. It will mean that there's better outcomes for patients.
But staff are facing a mounting treatment backlog.
It's no secret that the workforce is really on the decline, and we need to encourage young trainees to continue with general practice. Accessing a GP across the country could just look slightly differently, but we have never been closed, and the workforce is tired.
Whether it's a phone or face-to-face appointment, access is a mixed picture across Scotland.
I find it very difficult, especially now. I found it difficult before COVID, but especially now.
Getting through to them has been quite hard because I've been having to phone at 8 o'clock and then just keep pressing the button until I get it eventually.
No problem with our doctors. They deal with when we need it.
Although COVID cases are falling, with just over 5,800 reported today, for now the health service remains in a fragile state. Laura Alderman, STV News.